Hey y'all, it's Charlie again. I guess it's time for another update. Let's see, it's Sunday. I've been out of the hospital now for a little over a week. I'm healing up alright. You see I got the tubes out here. My scar is, well, it's a little swollen at the moment. It's either my fat neck is taking it over or something weird's going on with it. But you can see here where the doc took some of my lymph nodes, took 37 of them in total, and my face is a little misshapen. I don't have any sensation here where I'm touching. I can't feel it at all. And up here into my earlobe, I can't feel that. I mean, I can feel it with my finger, but not internally. But I can feel some of my ear. The doc says that'll all come back, so it's all good. My neck also hurts like hell. I told him, I said, I'm a little concerned about the sensation I got in my neck. That it feels like somebody's choking me. Not like I can't breathe or I can't swallow, but it feels like I'm in a good solid headlock. And he says, when he opened me up, he had his fingers down around my carotid artery and had his fingers far enough into the muscles of my neck to get all the way down to my spine. And he says, yeah, your neck's going to hurt for a while. And that's a good thing. If your neck didn't hurt, that means I messed up the nerves in your neck, and that's bigger problems. So he says, just keep taking the ibuprofen. It'll heal up, and you'll be fine after a while. But that's normal. Just let it ride, which is cool. So, it kind of sucks, but it is what it is. My tongue is doing pretty decent. It took about, I'm thinking, a little less than 20%. It kind of hurts. It's kind of weird talking with it, and I'm still getting used to it. Still getting used to eating with it, and getting used to the tongue feeling different and not being where I think it is in my mouth. But I'm doing well. I think I sound better. I'm not on all the high-powered painkillers, so like the last video I was on, I sounded really doped up, and this time I got a little bit of a speech thing going on, but for the most part, I feel like I can be understood. But I wanted to share with you guys my final pathology report. The long and the short of it is that I had two, what do you call it? I had two pieces of tissue that were sent in for examination. One of them was the part they took out of my tongue, the cancer itself, and the marginal tissue surrounding it. And then I had 37 lymph nodes taken out of my neck. First off, the lymph nodes. All 37 of them came back negative for cancerous tissue. It's good. The tongue part, the margins were pretty wide. All the marginal tissue came back negative for cancer cells, which means that A, it had not metastasized into my lymph nodes, and B, it had not entered my bloodstream, in my tongue. So in other words, it was just one mass that apparently stayed put. It was growing, but it wasn't spreading, if that makes sense. The grand sum total of the mass ended up being 8 millimeters by 7 millimeters by 6 millimeters deep. That 6 millimeters is what they call a depth of invasion. And that number is significant. So I got all this back. Doc says, you're healing well, you're doing good, you got a great prognosis, man, you couldn't ask for anything better. Sweet. He says, you need to go see an oncologist. I'm going to recommend you to this woman named Stephanie Hahn at Texas Oncology. It's across the street from his clinic. Hi, kitty. Say hi, kitty. Yeah. Anyway, I go over and see her, and she tells me, she goes, your final pathology, great report. But there's 3 criteria that they determine, or that they use to determine whether or not they recommend further cancer treatment, like chemo and radiation. She said that the first thing you need to consider is whether or not the cancer is metastasized into your lymphatic system, into your lymph nodes. She says, all your lymph nodes are clear. So it's great news. No cancer there. The second thing they look for is whether or not it's entered your bloodstream, which would be evident in the marginal tissue around the tumor itself, which is negative. That's good. So the third thing they look for is the depth of invasion of the primary tumor. And she says, this is the part where it gets interesting. She says, the depth of invasion of your tumor was 6 millimeters. And the threshold for which they recommend further treatment with radiation is 5 millimeters. She says, really, it's up to you whether or not you want to have the radiation. That either if I do it or if I don't, I've still got a great prognosis. She says, the question is whether or not you think the side effects from the radiation treatment are going to be worth the safeguard that you'll get from the treatment. She says, you've already got a great chance that you're going to survive it and it's not going to come back. The radiation will help. It's also going to hurt in some ways. She says, it's probably going to mess up your teeth. It's probably going to mess up your sense of taste. It's probably going to mess up your salivary glands. It's going to mess up your gums. It might mess up your jaw. It might mess up your cheek. It's going to mess up damn near everything in your mouth. Let me rephrase it. She says, it's possible. They're all possible side effects. It's even possible that the radiation treatment can give you another damn tumor, which apparently is extremely rare, although my brother and I actually happen to be one of them. It's extremely rare cases, and his radiation treatment causes another tumor. He's okay, by the way. He survived like 20 years after the damn thing. Anyway, so she says, it's up to you. You need to make this decision. And I said, okay, well, I'm gonna take all this information to my wife and we'll talk about it. So after I saw her, I saw my surgeon again, Dr. Brockhoff. And Brockhoff told me I had a conversation with Dr. Helen. Said, she told me what she told you, and I wanted to tell you my opinion on it. I'm like, okay, shoot, dude. And he says, what she told you is factual, that the threshold for recommending radiation treatment is indeed 5 millimeters. However, in my experience, anything more than a depth of 2 millimeters of invasion warrants radiation treatment. He says, I don't know if you were planning on doing it or not, but in my professional opinion, you need to have it. He says, I'm going to recommend it. I'm going to tell you this on a personal level, bro. You got a unique opportunity here to nip this thing in the bud finally. You don't want to have to go through another surgery and the further treatment if it ends up coming back. If you do this, it's going to give you the best possible chance of not having recurrent cancer. And I told him, okay, man, I still need to talk to the wife about it. You know, I mean, we got to make decisions together in life. You know, she's my partner. So I took what he said and what she said, and I talked to Brittany about it, and we both agreed that the radiation is the best course of action. Even though it's going to suck and it might screw me up, It's better than having to have more of your tongue removed because of additional cancer. Where I figure is I'm still relatively young. I'm 34 years old. Come what negative side effects may, I've still got my strength. I can beat it. I've got enough time in the rest of my life that I can get over whatever kind of issues come up. More than likely, any side effects would be relatively minimal and probably not permanent. If my teeth get screwed up, they've got reconstructive dentistry. If my skin gets screwed up, I'm sure they've got, something to help with that. One thing I can't do is grow back more on my damn tongue. So let's save it. So that's what I'm going to do. I have a doctor's appointment beginning of next week with my oncologist, which we're going to talk in depth about the course of treatment. Find out exactly what goes on with radiation. And I'll share all those details with y'all. I'm pretty sure somebody coming behind me watching this video, if they just got diagnosed with it, they're probably curious as to what's going on. So I'm going to provide you with as much detail as I can muster, without having to read out of a damn textbook or something. But so far, everything's working out well. I'm healing well. I'm feeling pretty decent. I'm no longer on the major painkillers. They got me on 800 milligrams of ibuprofen for the swelling in my neck, and I've been on tramadol, which I ended up asking to be taken off of because it was making me loopy and not helping in the pain at all. And they put me on a low dose of hydrocodone and acetaminophen. That stuff works pretty good. It really only helps with my tongue, which it still kind of feels like it's on fire every once in a while. But there's a lot of nerve damage, so. But I'm gonna start weaning myself off of it. I don't need any more issues. I don't want to take painkillers and get dependent on them or something. And I'm pretty sure when this radiation treatment starts, they're probably gonna have me taking more pills. Right now, I'm taking so many damn pills and mouthwashes and stuff. It's just. I hate taking medicine. I feel like my body's pretty good at taking care of itself, obviously, except for the freaking cancer. But, I don't even like taking, like headache medicine. It just goes against something in me, I guess. But that's where we're at now. So, anyway, I hope you guys are doing good. I was told one thing. The course of treatment is expected to run 6 weeks long, 5 days a week, going to El Paso, doing however long it takes to do it. It's going to be a full-time gig for a while. Right now, I'm on short-term disability, and as far as I can tell, it's gonna work out well. I'm not gonna end up in the poorhouse or something. But like I said, I'll let you know what happens. Anyway, I'll see you guys later.